Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing well. Beautiful fall morning.
Absolutely. Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing viewer-submitted questions, the latest headlines, and our lone U.S. COVID statistic through today, September 26th. We invite you to submit questions or suggested topics down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, average COVID deaths per day, 125 daily in the past reported week. In 2023, the same week, we saw 187. Dr. Murphy, your reaction to that number?
Yeah, we're starting to come off the peak, the summer peak, and the mortality cases are stable or dropping slightly. But the big news is the national wastewater surveillance for this virus has dropped in the Midwest from very high to high. So it's all good signs, as expected, and this will continue to go down to a dull roar. Remember, in May, we were having 20 deaths per day. Now we have 125. And then there'll be another peak in the winter along with flu, and we'll see how that goes. The current circulating viruses are these Omicron variants, KP.3.11. That's the most common one, and the new vaccines should work much better for that. And the vaccines are available now, so you should get, along with the flu shot, you should get the new updated COVID vaccine because it can help you with this one.
And along with those COVID vaccines, I understand that the free COVID tests from the government should also be available soon. Can you tell people where to find those?
Yeah, no, you can just go to covidtest.gov. It's the same program they had before. And by the end of this month, which is Monday, you can order 4 at-home test kits for free, and they'll just mail them to you. This is a great opportunity, so you don't have to worry about buying the tests. The tests, costs approximately $10 a piece, and you typically buy them in a box of 2. Because the thing is, one of those, if you think you have COVID and you're having these over-the-counter tests, if the first one is negative, you have to wait a day or 2 and do another one, because it really takes 2 to get the sensitivity up enough. So don't just give up if the one is negative. Of course, if one is positive, you don't have to do another one. But this will tell you that you have COVID, and if you're in a high-risk group, whether you should take a treatment with Paxlovid or molnupiravir, and whether or not you should isolate or wear a mask for a period of time.
And before we move on from the COVID vaccines, we have a viewer submitted question. The viewer has previously either taken one of the mRNA vaccines from Pfizer or Moderna, and like many of us, had those flu-like symptoms as side effects. They would like to try the Novavax this year, as they've heard there might be slightly milder side effects. Are there any advantages or disadvantages, or are all the vaccines working about the same?
In general, take whatever vaccine you want. It doesn't really make too much difference. There's sometimes an advantage to switching the vaccines. Some people tolerate the mRNA vaccines, the Pfizer, Moderna, better than the Novavax, but some people tolerate the Novavax ones better than the other ones. So it's kind of all over the place. Go ahead and try it. The important thing is just to get vaccinated.
Mm-hmm. And we actually had another follow-up question from our episode last week about the Metformin study. Our viewer has an older friend who has suffered from long COVID for several years with many symptoms. And when we talked about that Metformin study, it could reduce the effects of long COVID by roughly 40%. Can you clarify that? Is that a prevention of long COVID, or could that reduce the effects after the disease had started?
Well, a couple things. One is that was all about preventing long COVID. So metformin has been studied fairly extensively in prospective studies and in observational cohorts. The one we reported on last week was looking at a group of diabetic patients who were on it because it's also a drug used in diabetes. And they found that looking at all these millions of patients, that there was this very significant reduction in long COVID in the people on metformin. So, and this has been shown in other studies. Matter of fact, there's like 9 of them. And the use of metformin does work. It does help. And no one is really pushing it because it's a drug that's been around forever. It costs about $1. The bottle it comes in costs more money. And so you don't hear too much about it, but it's very easy to take. And if I get COVID again, I'm taking it. I had never taken it before, but I think the data is pretty good that this thing really helps. And if anything, you don't want to get long COVID. Look at this poor person, that this person is talking about. About 7% or so of people get long COVID. It can be very, very debilitating. So I don't know. It's prevention, but it is not. It does not treat people who already have it, unfortunately.
Mhm. And have there been any big studies or any big announcements regarding potential treatments for long COVID, or are those studies still ongoing?
They're ongoing, and it's being studied. Let's just put it that way. They're trying everything, but so far, treatments and the treatments that they've tried so far have not worked. But we're not
Mhm.
giving up. It's the money is just now getting into the long COVID world and being looked at scientifically. So that's what we need. We need nice, controlled, powerful studies to figure this thing out.
Mhm. And speaking of things that did recently get approved for next respiratory season, there's a big announcement regarding the FluMist nasal influenza vaccine. Can you tell us a little bit about that vaccine and its approval?
Yeah, this is a great vaccine um, for flu. You take it right in the nose. This is where you're getting exposed anyway. So you don't need a doctor's appointment. You need a prescription, but you don't need a doctor's appointment. A nurse or somebody does not have to give it to you. You can give it to yourself, or you can give it to somebody you're taking care of. So, as Peter Marks, who's the director of the FDA's Vaccine Center, stated, this is approval, the first influenza vaccine for self or caregiver-given administration, provides a new option to get a safe and effective seasonal influenza vaccine. Great convenience, flexibility, accessibility. It's just another great thing. So you don't even have to have a doctor's appointment. We'll see what the cost is and who's paying for it, but they're estimating it's going to be about $35 to $45.
Certainly a great option, and looking forward to seeing how that rolls out next respiratory season.
Mhm.
But looking into this current respiratory season, we always talk about COVID, RSV, and the flu. But there's been a little bit of a surprising infection, bacterial illness, that's popped up again this year. Can you tell us what it is and what effect it's having?
Yeah, pertussis or whooping cough. This is a bacterial illness. It's one of the leading causes of death from an infection in the world. Now, most people in the United States are vaccinated for it. Um, and when they get Tdap vaccine, which has also got tetanus and diphtheria in there. But what's happened is in 2023, we had in the United States now 3,475 cases. This year to date, we've had 14,500 cases. It's increased fivefold. This is the highest number since in the last 10 years. So what's going on? Well, people are a lot of people have just stopped taking all vaccines. And this is unfortunate. Now we're going to pay for it. There was just a report from Wisconsin. They reported that this year, not only nationwide, it's 5 times greater. In Wisconsin, it's 10 times greater. They went from 51 cases to 625, and the year's not even over. It's mostly younger people. In Wisconsin, it was 11 to 18, occurred in half the cases. Pregnant women are encouraged to get whooping cough booster during their 3rd trimester because it gives the babies some protection, because it's really can be very severe in young children. So stay up to date on that vaccine. You want to get whooping cough. We don't want to become a low and middle income country where, there's these hundreds of thousands of mostly child deaths. So got to stay up with the childhood vaccines.
Yeah, really unfortunate and preventable. And speaking of things that are a little bit mind-blowing, we have been talking about the unknown mysterious H5N1 human case in Missouri. Now, this week we got even more news regarding that first unknown case. Can you please share with us what that was?
So this is more the avian flu saga. We're afraid of avian flu because there's a higher mortality rate than regular flu. Okay, everybody understands that, I think. But to get avian flu, typically you have to be exposed to a bird or the milk of a cow, like a dairy farmer. Then all of a sudden there was this case in Missouri where this person got it and they hadn't been around any animals. So how'd they get it? And then it turned out that a person in the household also got sick, but never got tested. Or they got tested after they were already feeling better, so the test was negative. And now they're saying 2 healthcare workers who were in contact with the sick patient who had it also got sick with respiratory symptoms, but neither one of them got tested. I mean, like, what is going on here? I don't get it. Because if all these unknown cases, if they all have, first of all, nobody died. This is great. But if all these people are getting it in this cluster, that means this avian flu thing is starting to learn how to go person to person. So this is very important. But it's just kind of, the whole story is just so funny. It's just weird.
Very weird, and it seems like every day we find out something new about this mysterious case,
Yep.
but nothing concrete yet, so hopefully
Yeah.
we'll get some of that. But onto our other very big story that we have been reporting on for months and months now. There were new numbers released by the World Health Organization regarding the number of Mpox cases. Can you tell us about the number and about the status of the outbreaks?
Yeah, the update, which came from WHO just recently, is 30,000 suspected cases and about 800 deaths. So this is a potentially lethal case, lethal disease, of course. We've known this. Um, most of these cases and deaths were reported from the Democratic Republic of the Congo, and but other countries have been impacted as well. And India had its first case, for example, outside of Africa. And the vaccines have been finally, WHO approved them, and hundreds of thousands of doses have been shipped. They're being distributed now to the people that are actually giving the vaccines, and that is the actual administration of the vaccines is supposed to start next week. So that's good. But it's just a very unfortunate thing because this is potentially lethal. And even if you don't die from it, which is, I mean, that's like the worst thing, but people get very sick and have these terrible lesions and are painful. And it's just awful. So that's the status of what's going on with Mpox.
Not good, and we will keep our eyes on it, of course. But looking a little bit inward into the state of California, there was recently reports of locally acquired dengue. Can you give us a little more insight into those cases?
Yeah, dengue has had a crazy year, and it does typically go in this 4-year cycle thing where every 4 years it's like a big jump. So this year it's estimated there's been 11 million cases in the Western Hemisphere, mostly in Central America, the Caribbean, and South America, and approximately 8,000 deaths. So, there's another thing that can kill you. And most of the cases in the United States have been in people who've traveled to a higher risk area, coming back from the Caribbean or Mexico or Latin America, someplace. So anyway, there's now 3 cases. I think it's 3. Yeah, 3 cases of dengue in people who didn't travel. So dengue is here. It's de novo. It can be, you can just get dengue. We reported an earlier case several months ago, also from LA County. And so this is just another 3 cases. So, it's not that many, but it can happen here without any travel. And so that's the important thing. If somebody looks like they might have dengue and they didn't travel, you have to think dengue now.
hmm Now, looking to the other coast of the United States for our last story and a different mosquito, New
Mhm.
York State recently reported its first case of EEE in over or nearly a decade. Can you remind us what that is and about the cases here in the US?
Yeah, that's EEE stands for Eastern Equine Encephalitis virus. It's a rare mosquito-borne disease. Most people, if they get it, they don't have any symptoms or very mild, but there's a few people that progress to very serious disease and can die. So, okay, there's only 11 cases in the United States right now. 2 of them have died, though. 2 out of 11. If you look overall, the mortality rate is about 30%. So this is something you really don't want to get. If they find it in mosquitoes, or they usually will shut that area off to people because if you go in there and get bit, you got a 30% chance of dying. I mean, it's really unfortunate. And so this is it gets into the nervous system, and they get encephalitis and die. So the cases have been, this is the first one reported in New York State, but they've been reported this year in Massachusetts, New Hampshire, New Jersey, Rhode Island, Vermont, but also Wisconsin has reported it. So that's a neighboring state here, and it just people should be aware. There's been some 176 hospitalizations of the 196 reported cases since 2003, and 79 deaths overall. So that's just another thing to keep in mind. There's no treatment, there's no vaccine.
Yeah. Very scary, always important if you're traveling, just to make sure you know what to be aware of. Bring your bug spray always. And on that note, thank you so much, Dr. Murphy, for your expertise, answering our viewers' questions, breaking down the latest research and headlines. It's much appreciated.
Great. Thank you, Katie.
Thank you very much. And thank you all for joining us for another episode of the Ask Dr. Murphy series. If excuse me, if you have any questions or suggested topics, please leave them down below or at any of our social media linked in the description. We'll see you next week. Thank you.